everybody, Rob Berger from DoorRoller.net. Today we're going to take a look at Obamacare. I've put together this video to give you an idea of how you can find out how much health insurance may cost you if you opt to buy insurance through some of the exchanges under Obamacare. The actual exchanges will launch in just a few days on October 1st, but the federal government has released pricing for 36 states. As you may know, each state could decide to run their own health insurance exchange, or they could let the federal government run the exchange for them. And 36 of the states opted to let the federal government run their health insurance exchange. And it's those 36 states that we have some pricing information. What you see here is a web page from the Health and Human Services website. And as you can see here, the URL is rather lengthy. I'll leave links to all of these sites in the notes below this video. But on this page on the Health and Human Services website, if we scroll down towards the bottom, we'll see a list of the 36 states that opted to let the federal government run their health insurance exchanges in full or in part. And it's here that we can find out, at least get some idea of what premiums will cost. So I live in Virginia, so we'll use Virginia as an example. And again, if we click on the link for any state, it takes you to a page specifically for that state. And the first thing you might notice is that this is kind of a mess. In fact, if we scroll over to the far right, you'll see that this last column, you can't even read it. It looks like numbers have been printed over top of one another. This is obviously something that will get fixed here soon, I suspect, but at the moment, this is the information that the federal government has released for the 36 states listed. And so in Virginia, basically all these worksheets work the same regardless of which state you choose. But you can select your name your age in this drop-down box. And I'm 46, so we'll select that. And when you make that selection, the prices that you can see over here change. And so what you have are prices for what's called the catastrophic option, which is an option that's actually just available for a very small number of people. But then the main options, bronze, silver, and gold, there's also a platinum option. And interestingly enough, they don't have prices for the platinum option. But let's just walk through this so you get an idea of what we're looking at. If we again go back over to the far left, the first thing that you'll see is that in Virginia they have 12 what they call rating areas. And to understand what your premium will be, you'll need to know what rating area you live in. Every state has some number of rating areas. And to find your rating area, if we go back to the original page we were on, and again, I'll leave links to all of this in the notes, you select this site here, and it takes you to the cms.gov site where you can find the rating areas for all the states. We scroll down to Virginia, you see there are 12 rating areas. Click on Virginia and it'll show you by city what your rating area is. In my case, I live in Fairfax, so search for Fairfax and I can see that I'm in rating area 10. So if we go back to our spreadsheet, here's rating area 10. What this tells me is that there are 6 insurance companies that are part of the Virginia Exchange in rating area 10. There are a total of 63 policies. Qualified health plans is what QHP stands for. 7 are catastrophic, 24 are bronze, 7 are silver, 13 are gold, and you can see this is a bit messed up here. But then platinum at the end, there are 2. And so, and we'll talk in a minute about what those mean, but if we then scroll further to the right, what we're given here, and this is the column I'm looking at for my rating area, those are the lowest cost plans for each of those types of insurance: catastrophic, bronze, silver. They also show the second lowest silver plan, and then gold. Again, for whatever reason, they don't show pricing for platinum. Now, just real quick, bronze, silver, and gold, and then platinum, all of these plans have to have a certain minimum coverage. And we can actually see what that is here. This is on the healthcare.gov website, and it lists the types of coverage that every single health plan under Obamacare by law must provide. Now, health insurance plans can offer more coverage, and in fact, many of them will. And so when you go to compare plans, you'll need to look very carefully at the coverage. But this is the minimum coverage that they all must provide. So then what's the difference between bronze, silver, gold, and platinum? Well, the difference is how much you pay out of pocket. For the bronze plan, the insurance typically covers 60% of the health insurance cost, and you would be responsible for 40% in the form of things like co-insurance and co-pays and deductibles. Silver covers 70%, gold covers 80%, and platinum covers 90%. And so you can, again, that gives you an idea of what the different plan types are, and then you can look at the prices. Now, again, these are the minimum prices. It doesn't necessarily mean it's the best insurance. And there are a couple of things to consider when you end up comparing plans. One, of course, is exactly what they cover. Again, if you go back to this website, this is the minimum, but some plans may choose to cover more. And the second thing is the network. I mean, the doctors that you may want to visit may or may not be in the network for any of these plans. So that's something to give some thought to. So that's how you determine, again, at least the minimum cost by state for the various plans that are offered. Again, this is limited to the 36 states. Let me go back to it. The 36 states that the exchanges are being run by the federal government. Some of the states that are running their own exchanges have already released pricing plans, but they'll all be released by October 1st, and I'll update another video with details on how to track down premiums for those other states.